so welcome. Today we are going to be diving into injury prevention and recovery. The title, You're Injured, Now What? Definitely how we should handle our nutrition once we're injured. But the bigger impact that I want to make sure that you guys leave with today is the fact that prevention really is the key. And as triathletes, you'll see we are very likely to get injured. It happens to all of us, more so even than in other sports, which we could argue is because we do 3 sports, 4 if you add strength training in one, which just puts us at a greater risk for injury. All right, I am going to get my screen going here. Let's do this. Okay, can everyone see my screen? All right, thanks, Jay. Okay, injured, now what? There we go. So for today, why injuries happen, how to find the new normal, kind of the balance between what you're consuming, your exercise or lack thereof, how to get back into it, macro and micronutrient requirements, and then some open Q&A at the end. All right. Did you know the most common injuries in triathletes? I think this is really important for us to kind of wrap our brain around. Overuse injuries and stress fractures are the #1 cause of injuries in triathletes. And I think that's because we ignore the problem. We ignore, it's like, oh, this little niggle, I'm fine, or it's not that bad, or if I don't have the time to keep, to stop training. And so we just kind of keep working through it. Specifically, when you're looking at injuries, we've got shoulder pain from swimming, knee and ankle pain and strains, back pain and neck pain from those long hours in the saddle, shin, heel, IT band pain, and then that weak and torn hamstrings. I'm curious, how many of you guys have been injured whilst doing triathlon? All of us, or sport in general. So we all know, and it's pretty common if you haven't been injured yet this season, that's great. Hopefully, through wise coaching, proper nutrition, that doesn't happen. A study found in the kind of 6 months leading up to your race, 87% of triathletes reported an overuse injury. It's something, it happens to all of us. So while you might not be injured at the moment, that potential is there if you're not properly taking care of yourself. And I just thought it was interesting in terms of location. Knee and spine were the most frequent, running and cycling, obviously, that pounding, that very repetitive motion. And I thought it was interesting too that elite athletes have a lower incidence of overuse injury. And I think that's probably 2-part. One, because they've been training their bodies for a long time, and so it's used to a greater load. 2, I think they are very tuned in with their coaches and they speak up if they're not feeling well, if something feels off. I think their coaches are, monitoring their training pretty particularly. Most of them do have some kind of nutritional support, whether that's, working with us, whether that's working with a dietitian or nutrition. They really pay attention to those things. And they do that extra stuff that we don't always prioritize. Strength training, massage, myofascial release, mobility, all of those kind of components. So taking the time to do these things or implementing them into your training schedule will be really beneficial in terms of preventing injuries. Prevention is the best medicine. If you haven't heard me speak for the last couple of years, strength training, I have found, as someone that was constantly getting injured, has been the best thing for me for multiple reasons. hence the reason this was the photo that I chose. But there are other things, other components besides strength training. Number one that I really want you to take away in terms of prevention, but also for healing: underfueling, not properly fueling your body and giving it what it needs. Some studies have found that up to 60% of athletes are underfueling or fueling improperly. So whether that's low energy availability or the red syndrome, energy deficiency, this is what we see leads to those bone injuries, which are very hard to heal, very hard to come back from. Stress fractures, these are those long-term implications of chronically underfueling your body and not giving your body the energy that it needs. And they found specifically low carbohydrate availability. I know that it's trendy, and hopefully all of the Fuelin athletes know how important carbohydrates are. But if ever in the back of your mind, you think, oh, I can go a little lower carbohydrate, I don't need to make sure that I'm meeting my carbohydrate needs for the day. We have found specifically that low carb, as opposed to lower fat or lower protein, low carbohydrate availability does lead to those long-term bone injuries and can add to muscle strains. So damaged muscles and tissues need fuel to repair and grow properly. After your training, your muscles and tissues are damaged. So when we say and put into post-workout meal and or snack is important, you don't want to miss that. We are trying very specifically to refuel, repair your body, grow properly. If you're not fueling properly, you're at a greater risk for muscle strains, muscle tears, tendon inflammation or tendonitis. It also, by not fueling properly, means that your body takes longer to recover, not just from training, but to recover from those injuries. So managing your fueling on a daily basis and keeping it a priority is really going to help prevent those injuries. Other factors that you can do and make sure, or that interfere with, increase your risk of injury, not strength training. Unfortunately, getting older, as we get older, our bodies we're more likely to get injured. All of us know that, right? When we were in our teens, early 20s, we could do anything. Even if you got hurt, it felt like, 2 days later, you're fine, no big deal. It's just kind of a fact of life. We get wiser as we get older, but we're easier to injure. Increasing training distances. So if you're making that switch from, say, sprint or Olympic up to halves or fulls, high running mileage, especially during the off season. I know a lot of times that's when we will try to work on some, if we're not great at running, that's when we'll try to start, take a break maybe from the cycling or swimming and increase run mileage. That can lead to injury. If you have a history of previous injuries, that sets you up or makes you more likely to be injured in the future. And I think it should be a red flag and a warning sign. Oh, I'm always getting this particular injury, or I'm always, I've had 2 stress fractures. These are warning signs that you're probably not fueling properly, and you need to take a look at your training, looking at strength training, mileage, that kind of stuff. And then poor technique and biomechanical imbalances, which is why we say it's important to have a coach. It's important, even if you look at poor technique, if we turn that into nutrition, that's why you guys came to us, so that we can make sure that your technique and imbalances are taken care of. We're in there making sure that you are getting those greens every day, hitting those protein requirements, making sure there's enough fat to help with immunity and repair and inflammation. All right, at this point, let's see. Questions? Anyone want to raise a hand? Speak up.
So can I offer just a little thing coming from my perspective and I mean, it gets a little personal and there's genders of all types on this call. So I just turned 64 last week. And so when I was younger, I started running. I was a swimmer as a kid, and then I started running more seriously when I was about 39. And when I was about 42, my period stopped forever, never came. I was thrilled. Woohoo! Don't have to deal with that anymore. That would have, that's the greatest thing. And I was not premenopausal. I didn't hit menopause till mid-50s, so it was way early. And of course, medical, they wonderful OBGYNs and doctors, but they just don't know and think of the perspective. At the time I was told, well, it's female athlete triad. And I said, I'm not one of these skinny runners and doing the whole thing. I mean, I could run well then and, had, good times and stuff for the locally. And so, but still, that's not me. I'm not part of that. Well, I got a stress fracture, sure enough, when I was like 45 or 46. I found out when I broke my hip, I have osteoporosis. And so I'm just sharing this personal stuff because I'm 64 now. I just turned 64 last week, which I don't feel it, but I look back at, it's not what I've done in the last couple of years that caused the osteoporosis. It's what I did when I was younger, because I did not know. I mean, there's the getting the sun and the vitamin D and all of that kind of stuff, which pretty much my understanding is most of that we get in our 20s, and then it just negligibly declines. And then once you hit menopause, you're pretty much screwed, but the whole thing. But I never thought, the nutrition part of it. And so it's tempting to want to cut back and do all that kind of stuff, but it's a sad price to pay later in life. And, so anyway, I'm sharing that in case it helps anybody think about like the dire consequences that it could face decades later, literally. Yes. I think that's my speculation is what a link potentially is. So.
Thank you. Thank you for sharing that. I think the more that we talk about our personal experiences with this, the more we realize it's not just me. It does happen to all of us. And, it's hard because you realize too late that you should have, of the things that you should have been doing. I too had multiple stress fractures in my ankle. And I know it was from underfueling, and whether that's intentional or not, there are consequences that you will have to pay. And especially when it comes to bone density, both men and women. So it is important to be fueling properly throughout: vitamin D, calcium, all of those. Thanks, Pam. All right, when we are looking at nutritional interventions and repair and recovery, kind of 3 key considerations that you want to have, 3 areas. The first would be inflammation support. The second would be immune system support. And the third is regeneration and anabolic support. These are all equally important, just how I listed them across the thing. So inflammation support is making sure that your body has that fine balance. Inflammation is good. That's how our body recovers and repairs itself. However, too much inflammation is bad. So we have to kind of walk that tightrope of allowing our body to be inflamed and start recovering and repairing, but making sure that it's not excessive or chronic. Same thing with immune system support. Our bodies will not heal properly or recover properly, if you're looking at injury prevention, if our immune system isn't functioning properly. And then that regeneration and anabolic support, obviously daily in prevention, we are trying to make sure that our muscles and tissues and bones have the nutrients they need so that we can train the next day. But specifically, if you're injured, we are looking at either regrowing bone, strengthening bone, tendons, cartilage, those muscles that we may have torn or have tendinitis, and then supporting muscle protein synthesis, that anabolic support, so that our body can repair itself. Also, so that we are maintaining body composition, not losing muscle mass, not losing, gaining added fat while we're healing from injury. A lot of info here on this slide. We're going to break it down. Nutritional interventions specifically. Most importantly, as always, as we always say here, food first. So we'll look at some of the supplements later, but you really can take care of your body properly by eating a well-balanced diet that has enough. So eating enough, we call that adequate total energy intake. That's the technical term. That is meeting your daily caloric needs. I put in here because I think it's really interesting just to see what a difference your daily calories makes. So if you are only fueling with 30 calories per kilogram of lean body mass a day, so let's say your daily caloric intake should be 2,000 calories a day, and you reduce that to 1,700 calories a day, bone formation is already reduced. You are already at, you're not recovering and repairing properly. If you go to that severe reduction in energy availability, so if you go down to say 1,500 calories, 1,200 calories a day, that's where you see both reduction in bone reducing, increasing in bone reabsorption, loss of muscle mass and tissue. So it's easy for us to go, oh, well, I'm not exercising, so maybe I can cut back on calories. But even slightly cutting back on calories is already having an impact. And then significantly cutting back on calories really has an impact on our body. So eating enough and meeting your daily caloric needs is very important. To kind of, but you say, but I'm not exercising like I used to. Your body is actively working to repair itself, especially when you are injured. We think just because you're not exercising doesn't mean that your body's not burning calories, rebuilding and repairing itself. How you want to handle that balance, there can be a slight reduction in carbohydrate intake, slight, but you increase that or keep that caloric, meeting your daily caloric needs by increasing daily protein. So usually we have you anywhere between 1.6, 1.8 to 2 grams per kilogram of protein a day. You want to increase that to 2.2 to 2.6 grams of kilogram of protein per day. So a significant jump, especially if you were on the lower end before. And that's where you're going to see slightly reducing fat and carbohydrate intake and increasing that daily protein intake. In the same respect, polyphenols. So these are all of those colorful fruits and vegetables that you see that are full of all of those micronutrients. We can get, as you'll see listed below or on the next slide, we can get zinc and magnesium and copper and vitamin C and vitamin A and some vitamin D from the foods that we eat. So including all of these fruits and vegetables and having a varied diet with, lean proteins and quality carbohydrates, you will be getting a lot of these nutrients that your body needs. Before we go further, questions on because this really is important to get that idea of maintaining daily calories, adequate total energy intake, and increasing protein.
No question, but I ran to get a cheese stick and my momentum recovery shake because you reminded me.
Excellent. Happy to, this is what we need. Excellent. Lead by example. Thank you, Iris.
No, because I'm doing exactly what you said. If I'm not feeling hungry, I'll be like, I'll just cut here and I'm not going to eat. And I am looking to underfuel something here. I'm not dieting, but if I'm not hungry, then I'm not actively looking to refuel. I just kind of eat intuitively, and that's not good.
Yeah, well, I don't want to, say, we should just be eating all the time. However, like I said, it's the choices that you make and actively going, just because I'm not hungry doesn't mean that my body doesn't need some type of fuel. And so actively going to get the things that we know you need and preventing, even if you're not hungry now, you might be extra hungry later, or you might be going into an evening session underfueled, which increases that risk for injury or not performing as well in that session. Great job, Max. Good job, Fuelin. Okay, so some of the supplements that you can look to add when injured, I would almost argue these are supplements that you should be taking on a daily basis anyway, especially if you have done your blood work and you know that you're deficient in some of these areas. Omega-3s. Not only are omega-3s important for inflammation, lowering inflammation and helping our body recover, it also helps with protein synthesis, they're finding. So unfortunately, we as a society consume way more omega-6 oils than we do omega-3s, just because it's so much easier to get omega-6 oils. We don't want to eliminate them, but we want to make sure that that ratio, that it's more omega-3s than omega-6. So when you're looking at omega-3s, that's the fish, sardines, mackerel. You can even get it from some seaweed sources. Nuts, seeds, avocado, olive oil, those, you want more of those fats and less of the soybean oil, safflower, sunflower oil, cottonseed oil, canola oil, those kinds of things. If you know that you're not consuming enough omega-3s in your daily diet, consuming an omega-3 supplement daily is a good idea. Specifically for injury recovery, injury repair, if you want to up that, once you've had that initial, like I said, we want some inflammation, so allow your body to be inflamed and start that recovery process. But then for 2 weeks, making sure that you're hitting that 5 grams a day with fish oil can help promote recovery. Same thing with vitamin D. If you are not taking a vitamin D supplement daily, you can look to up that to make sure with bone healing, 2,000 to 4,000 IU of D3 a day, taking that for 4 weeks. Calcium, especially if you have a bone injury like a stress fracture, or if you've undergone, if you had to go in for surgery, maybe ACL repair, tendon repair, something like that, that vitamin D and calcium combo, very important. Creatine, 5 grams a day. Not only are you hopefully already taking it, but especially if you're not, you're injured, now's the time to get that in there. You can, depending on certain injuries, ACL tear, knee injuries, potential neck and spine injuries. There have been some studies that show that doing a loading phase of creatine can help, which is where you do 20 grams a day of creatine for 14 days, and then return back to the lower 5 grams per day. I would say speak to your doctor and or Scott or myself before just diving in, because there are kind of some consequences with loading with 20 grams of creatine. So it might not be particularly beneficial. However, if you have, you're 4 weeks out from your Ironman race, or you're trying, time is essential, or it's been a very serious injury, potential concussion or something like that, speak to one of us, speak to your physician about loading with creatine. There could be a benefit there. And then collagen, one of the most studied in terms of muscle, tendon, tissue, ligament repair. 20 grams plus 500 milligrams of vitamin C, 40 minutes before activity. You didn't see my video the other day. Make sure it's not taken with caffeine. Lesson for myself, I used to always take it every morning with my tea. Now I know, not great. So, and when we say before loading, it's best to be done before strength training. You can do jumping rope, running, any kind of like impact activity that's going to increase the absorption and effectiveness of that collagen.
Elizabeth, is it the hot drink? The collagen in the hot drink is the issue? It's the caffeine. So for example, if someone is drinking decaffeinated coffee and collagen, is that okay?
It's the caffeine specifically. However, we know even some decaffeinated beverages can have small amounts of caffeine. So I think you're probably safe with decaffeinated coffee. Just be mindful of the size of the cup that you're consuming. You know, if you're putting like the large versus, you know, a regular cup of coffee, even decaffeinated. The reason that I love it in hot beverages is because it dissolves so much easier than in a cold beverage. And it just tastes better when you mix it in with coffee or tea than water. So I'm learning. This morning I had it just with water. It was not quite the same.
Then didn't you wait and have your coffee after your workout? This like wrecks my whole morning routine.
I know. I'm telling you, it completely threw me off. So yes, I waited almost 2 hours and I haven't, like, I'm doing a run later. I went out for a walk. A walk can even count as loading. So I had water, lukewarm water with collagen mixed in, and a squirt. And the Momentous collagen has vitamin C in it, but I added some lemon to the water just for flavor. Went for my walk. It was almost 2 hours. Then had my morning cup of tea.
Wow. Okay.
I know it's tricky. Here's how you can kind of get around that. If you're doing multiple sessions for the day, you can switch the collagen to the second session of the day, because then you'll still get that benefit from the impact of your training. If you're not specifically looking for, if you're not injured and you're just looking to maintain daily collagen levels, you can take it at night before bed, you know, mix it with, you know, almond, like I'll heat up some almond milk and turmeric and, you know, maybe put the scoop in there because I like it hot better, or just changing the timing in the morning. I know it's not convenient.
Yeah, those are great suggestions though. Thanks.
There's no easy way to deliver this message. But specifically too, I don't know how many of you take a pre-workout. It's a lot of my like strength and CrossFit athletes that I work with will do a scoop of their pre-workout and then a scoop of their collagen and take it, you know, right before they're going to train. And pre-workout supplements are crazy caffeine, you know, loaded with caffeine. So they're really screwed. Yeah. Really have to adjust. Any other questions on some of the supplements?
There's a question in the chat from Lena on creatine.
Would you recommend it for all kinds of injury, muscle? Great question. So specifically for, I would recommend increasing that collagen specifically for any kind of traumatic brain injury. So if you were out and were in a, you know, bike crash, even if your helmet doesn't feel like it, you know, and you hit the pavement hard, it's in there. That's definitely a time to look at loading. So any kind of traumatic brain injury or concussion or something like that. Surgery, if you've been in for surgery for any type of injury or repair, and then possibly for a bone injury. Muscularly, I don't know that, I mean, it's important for any muscle injury to be taking it. The studies haven't shown that increasing to that 20 grams is going to increase or speed up healing, if that makes sense. Right. Turmeric, we're getting to turmeric next in some of the nutraceuticals, so to speak.
Elizabeth, just another quick question. Sorry for before my battery died, so I disappeared in the middle of my question. or your answer. For creatine, I know that it's recommended when I looked at the instructions on the box before or after workout. Is there a negative side effect, if you will, if I forgot to do that and I just take it at night, a few hours after the workout, and it's better just to skip it, or better to get it in even if it's later?
Excellent question. Better to just get it in. The important thing is that you take it and take it consistently. The timing is less important in the grand scheme of things.
Okay.
For strength building, for like in longer duration training sessions, it can be very, very effective. And so it's beneficial and advantageous to use it surrounding training. But if you don't take it, still the most important thing would be to make sure that you have it somewhere in the course of your day so that you're maintaining those levels. Great question. All right. No, that's not what I want. There we go. All right. Additional, we call these nutraceuticals. This is I hate the use of the word hacks because so many of them are just utter crap. However, there are components and things that you can use to help your body heal, potentially at a faster rate. Most of these I would recommend taking regardless of whether or not you're injured. Turmeric, definitely something that I take daily. Garlic, seasonally, I will take it. Glutamine, definitely daily. So useful in the context of your daily life, but also potentially useful when it comes to injury, repair, and recovery. Obviously, turmeric is an anti-inflammatory, helps with blood flow and blood circulation, which when you're injured, we know getting proper blood flow to that injured area speeds up recovery. Garlic, again, another anti-inflammatory, also helps with regulating blood pressure, which obviously circulating blood helps. Bromelain is anti-inflammatory, but has also, we've seen that it can help with lowering cortisol levels. It's found in pineapple. So where I have that 2 cups, I mean, if you like pineapple, who amongst us wouldn't just love to eat 2 cups of pineapple every day? Delicious. However, when you're looking at energy balance, eating 2 cups of pineapple could possibly throw off your daily caloric needs and requirements. This is one of those instances where I might swap, potentially, instead of maybe having a banana as a snack, I would have a cup of pineapple. Instead of putting a banana in my smoothie, I would add, a cup of pineapple. So just something to be mindful. It's a great recovery, lowering inflammation, lowering cortisol food. I keep frozen pineapple in my freezer all the time to add to smoothies or have with cottage cheese or whatever. Glutamine, very specifically, we have talked about glutamine to have in that post-workout shake, post-race shake, incorporating into your daily diet. Glutamine is very important for all of the things. It helps with inflammation. It helps with immune boosting. Especially if they've done many studies on patients following surgery, just because they're an easy group to test. They're in the hospital. We're controlling all of their, controlling their energy intake and whatever other nutrients they might be consuming. Glutamine had a very strong effect in muscle healing and recovery, in immune system boosting. If you are going in to have surgery, I would absolutely recommend upping your glutamine intake to help prevent infection, to help speed up recovery. The thing with glutamine is we can get it from food, lean proteins, beef, chicken, fish. beans, even making sure that we're getting enough for that 15 grams a day is where we might be missing the mark. If we don't have enough glutamine circulating in our body, it will find it from somewhere. And our muscles are an excellent storage unit for glutamine. So this is why a lot of the times you see when you're injured, you see that muscle loss, because partially you're not training as much, but partially your body is pulling that glutamine from your muscles. So you want to make sure that you have enough glutamine in your body in order to prevent muscle loss, encourage healing, and kind of support your immune system. I recommended 3 to 5 gram doses. So 15 grams a day divided is so that way you have that constant, like almost like a feed or a constant drip of glutamine. Below I have the maybes. You want to be careful. All of these vitamin A and vitamin C are anti-inflammatories. We know that they can not only blunt training adaptations, but if we're trying to allow some inflammation, these can prevent that. So you want to save the vitamin A, vitamin C for, at least 2 weeks after your injury. Or if you see inflammation being a chronic problem. Copper, again, you can probably get that from your diet, but they have shown that helps with bone recovery. Zinc, same thing, also helps with immune system support. I want to point out the thing that is not on here that a lot of athletes do when they are injured is they take NSAIDs, anti-inflammatory pain relief. Not telling you have to be like a tough guy and not have any kind of pain relief, but you should know that if you are taking those Aleve, Advil, whatever to help reduce pain, you're also potentially slowing down your recovery process, impacting your body in a way that it's not recovering properly on its own. And that might also be masking other symptoms, that your injury could potentially be worse. It might not be healing as well. So avoiding NSAIDs, if possible, would be a good idea. All right. Did I answer the turmeric question before going on to the next bit here? Are there any questions on some of these, how you should incorporate them, when not to?
Oh, that was perfect. Thanks for that.
Great.
I guess my question is, when not injured on a regular basis, how should we look at this list then?
Great. I first look at your overall diet. If you know that you are, if you're adding turmeric to recipes, if you're cooking with garlic, if you are eating foods, fish, chicken, beef, in, the quantities that we're recommending, if you're meeting your daily protein needs, most likely you're getting and eating a variety of fruits and vegetables, and you're most likely getting enough of these nutrients. And if you've had your blood work done, we can have a better idea, if cortisol levels are up or creatine kinase showing that you're inflamed. That's when potentially turmeric and garlic could be very helpful and beneficial. If you're not recovering maybe properly, it's a good sign that you're potentially not getting enough of these. I know personally, I take turmeric, glutamine, zinc seasonally in order to support daily needs. And, I like turmeric for Alzheimer's prevention. I like garlic for my heart. Glutamine, I know, helps with my gut. So on an individual basis, look at your daily diet and then look where you might be missing some of these things.
Okay, thank you.
Sure. All right. We're going to do a little quiz. I want to see if you can speak up. As to review, I think it's important. A lot of times we forget that even as adults, we're still learners, and it's still important to go over the things that we spoke about before so they stick in our brain. The most common injury among triathletes. You don't have to raise your hand, you can just speak out.
Overuse.
Yes, yes, there we go. Overuse, exactly. We are stubborn creatures of habit who are very good at working through the pain and ignoring potential problems. We also get very much in the habit of swimming, biking, and running, and not incorporating that ever important strength training and mobility and prioritizing that as much as our swim, bike, and run. So if we can avoid those overuse injuries, be smart about our training, hopefully you will not be in the injured category. Number 2, what is the best way to prevent injuries, nutritionally speaking?
Meet the caloric intake.
Yep, exactly. Meeting your daily caloric or energy needs, total available energy intake. It's not only the best way to prevent, but it also, when we're looking at healing, that's going to have an impact on how quickly and efficiently and thoroughly you recover. Number 3, how much should you increase your daily protein intake while injured?
Up to around 2.2 grams per kilo per day.
Yes, great. Yep. 2.2 to 2.6 on the high end. Again, we can adjust that. But yes, to at least to 2.2. That's the standard, which could be significantly more. If you want to take the time to figure that out, just so in the back of your mind, I think it's always a good idea. I like to know, okay, what are my minimum in general? What's my maximum? Worthwhile knowing. Okay, number 4, last one. Name at least 4 additional foods or supplements to help with healing. You can do 1, you don't have to do all 4.
Garlic.
Garlic.
Mary.
Excellent.
Mary.
Excellent, thank you, great.
Something that in the pineapple, bromelain, something.
Exactly, bromelain in pineapple, yes. Some others that can help: creatine, glutamine, omega-3s, really want to stress the importance of that, and then vitamin D and calcium are some other great ones. Excellent job, you guys. I can tell everyone was listening, paying attention. All right.
Good teacher.
What I really need is like a classroom and a big whiteboard so that I can move around. I don't like, the teacher in me doesn't like being confined to my little chair. I'm very, very visual, and I like to have room. Okay. Questions on the presentation or in general when it comes to injury prevention or recovery? Anything I didn't cover? Any specifics? Okay.
Just a quick question on losing weight. Then, how do you lose weight while trying not to be injured, and you still got to reduce your caloric requirement?
Yes, I would say the bigger priority while injured would be not losing muscle mass and maybe maintaining or not gaining weight. It's depending on your injury, you will, and if you're actively doing your rehab and PT and recovery and whatever, a lot of people will lose weight. So it's really, how do you prevent gaining weight? And that's where that protein comes in. So changing the percentage of your daily calories. So again, if you're consuming 2,000 calories a day and before gosh, I'm just going to say this is not what it is, but let's just say for numbers, 800 of those calories were from protein. Actually, that's bad. 500 of those calories were from protein. 1,000 were from carbohydrates and 5 were from fat. We're going to switch that ratio. And now you're going to have 1,000 calories from protein, let's say, 500 or 600 from carbohydrates and 400 from fat. Does that make sense? We're just changing the ratios. So in order to prevent weight gain, higher protein consumption, lower carbohydrate and fat consumption.
Okay, so we don't change the amount of calories, we just change the mix then.
Yes.
The macronutrients. Okay.
For the most part, again, if it's a serious injury and you're going to be very sedentary, but that's where we get in trouble by not meeting those daily caloric needs. Underfueling is when the body really doesn't have that ability to properly heal and repair and keep your immune system functioning and all that kind of stuff. It matters too what you choose to eat. So if you are I hate using the term good or bad foods, but if you are prioritizing leaner protein sources, fish, just being very smart about what you're consuming, because it's, as we know, calories in, calories out is kind of an easy but yet not accurate. So making sure that the calories that you are consuming are coming from really nutrient dense foods. I know from being injured, it was easy at first to feel very sorry for myself and like, well, I'm just gonna eat frosted mini wheats. I'm not out there exercising with everybody else. I'm miserable. I don't want a salad. I want a bowl of cereal, you know, so making smart choices as well will help with that energy balance.
Thanks.
Sure.
Can I just jump in?
Yeah.
Yeah. Was the question how to lose weight?
Yes.
Yeah. I think like, so I've been injured, like, or having some niggles for around 3 months now. We'll find out tomorrow, I think, what it is. But anyways, so Scott and I had a plan that I, at this point, were 2 kilos lighter than I actually am. But we kind of just like stopped that. Press pause on that plan to kind of lose weight, even though when I got the niggles and stopped running, I was like, well, I still feel like now I'm not running, so I want to do something else. I still want to do my like nutritional plan that we'd set out. And you know, it was just a matter, I think Scott was really good in just like, okay, just press pause. Like if you go into, it's also your point, like the one of your key takeaways, right? That if we go into too much energy, negative energy balance, then like the injury will just not heal itself. So or not that quick. So I think for me it's really been a patience in staying in energy balance and being okay with not being on the plan A of the nutritional strategy that was to thread a bit of body fat. To be leaner at this time and just be like, okay, well, now we gotta fix this first, and then, well, the plan will still be there. It will just be two months late or something like that.
Exactly. Yeah. Thank you so much for sharing your experience. But I think it helps us to hear that it actually works and it is healing your injury and you are feeling better. Fingers crossed. We'll see for tomorrow. That you do a priority shift a little bit in terms of priority number one now is not specifically weight loss, it's injury repair and recovery, so that you can get back on it when your body's ready.
Yeah.
Yeah, that's great. Thank you.
Yes, yes, yes.
Quick question from me, Elizabeth.
Yeah.
I think I don't know if Laurent was mentioning, trying to get at this as well as, so if we have an athlete that's losing on a weight loss plan, we do build in a calorie deficit week over week.
Mm.
And what are the key considerations to make sure that as a result of that calorie deficit, we're not sort of making a athlete more injury prone?
Sure. So number one, and this is because I've had some athletes, you have to tell us that you're injured. Don't keep that information to yourself. Let us know, what the injury is, what's going on, so that we can adjust. And Scott and I have both said that we will make the adjustment. And again, depending on the injury and depending on what you're able to do and what your activity level is, we may leave that caloric deficit because that will still balance with your lack of training. So it will even out. However, if it is a more serious injury and you are trying to repair, we will switch to more of a maintenance than a weight loss piece. So did I answer that correctly enough? Or enough? So yes, let us know when you're injured and what the protocol is for treatment and recovery. And then we will adjust from there.
Yeah. It's a two-part question. The first one, is it okay to think about, say, the last building block of Ironman training, almost similar to injury in terms of damaging the muscles and the need to repair? That's the first part. And if yes, do you take those supplements like glutamine and creatine and on the days of big workouts, like, the 100-mile and 3 hours run? Or do you take it the entire training block of like 4 or 5 weeks leading to an Ironman? So it's two questions. First of all, am I right to assume it's an injury-like? And if yes, do you take it on big days or the entire period?
Great questions. Yes, I would treat that last big block of time as potential, you're at a heightened risk of injury. It's when you're also looking at a potentially lowered immune system response because your body is exhausted, you're training harder, you're stressed because your event is coming up. So that window is a very crucial window to make sure that you are properly monitoring your diet. Now, specifically when it comes to what to take and how to incorporate those things in, what we're doing on our end, when we see your race, your race on the calendar, we are calculating in that added training. And so we are increasing caloric needs or making sure that that's matching your training. So on our end, just the general energy balance is being accounted for. In those additional supplements, it's absolutely a good idea to maintain throughout the creatine, vitamin D, calcium, glutamine, those components. Personally, I will add in or use sporadically the turmeric or the bromelain or, on to help facilitate repair specifically. So, and that's where you have to be careful with antioxidants and blunting training adaptations. Using it, you have your long brick, let's say it's, 6-hour ride, hour run. You want to take your turmeric well after training. So not immediately before or during. because you're trying to have your body get used to that. You want that inflammation, but then we want to lower that later. So I would take it at night, again, before bed. Same thing with the garlic. The creatine I would use during my bike session. I would take it about halfway through to help with energy and muscle repair for the second half of that lovely 6-hour ride. So being smart and strategic with it. I would also, if you're not already taking a probiotic, it's a great time to add probiotic in to help with immune system support. You're going to be traveling to your race. You're going to be tired, stressed. I think that's a great time to make sure that that immune system is functioning on all cylinders. It's also potentially, if you don't use, if you don't use sleep products, I sleep well. I do, however, in those couple days leading up to a race, I do not sleep well. So that's when you might consider incorporating, something to help with sleep so that you are going in rested. Because we know when you're not sleeping, you're not recovering, your immune system function drops, you're more stressed, et cetera, et cetera. So whether it's, momentous sleep, Beam, I think makes one, don't like go wild on melatonin or anything. But there are sleep products that can help. Even magnesium, there's Natural Calm can help at night. So that's another thing that I would prioritize in that block.
Excellent. Thank you so much.
Of course. All right. I think we're almost on time. I think we got hopefully a good session. Hopefully we are avoiding potential injury, taking care of ourselves. And even if we start to feel like we are, there you go, Iris, thank you very much. If we are feel like we may be having some injuries coming on, remember that you don't have to be the tough guy, be smart about it. Overuse injuries are a thing, don't ignore them. Take care, fuel properly. All right, I'm gonna stop the recording, and I know if there's any other questions, app related, Jonathan and I are here for that.